So we are discussing the historical development of welfare state in Britain. We have discussed the starting, the inception of poor laws and their abolishment in 1929. Now we discuss the health reform in Britain. So how the public health started in Britain. So there was not much concern about public health in the 18th century. There were, of course, public health became important when there were epidemics, but once the epidemics had gone or ended, there was not much concern about the public health of the people. And there was, of course, no statistics, no knowledge what was the average age of a person in England or in Scotland. So nobody was concerned about how many people are dying in their 20s or 30s or whatever. So as the population increased and as the migration of this population increased from rural areas to urban areas, concern about health increased. So there was fourfold or even eightfold increase in the population of cities. Some cities in the British, for example, Birmingham or London. So think about the fact that, if the population of Lahore increases by 4 times or Islamabad increases by 4 times, what will happen? So, of course, there will be lots of slums. People will not have proper housing. There will be no water supply. There will be no sewerage. And there will be no refuse garbage disposal. So all these things were not there, and of course it affected the health of the people. There was illness, there was disease, there was epidemics, and even the middle class were affected. So if it had limited to poor classes, even then, people will, people in the upper level or the decision-making level would have ignored it. But it started affecting the middle class level too. So the elite were concerned about the public health. And here, the poor law, the application of poor law helped, because in 1834 there was this, as we discussed last time, poor law was implemented, and related to that there was statistics and people who were studying the effect of poor laws. So when the experts studied poor laws and the effect of poor laws, they realized that health is related to poverty. So people get disease, people get ill, people are unable to work because they are not healthy. So they then gave this status, published this status, and they became known to the government, and then they decided to come up with the Health Act. And the Health Act of 1848 established local boards of health and appointment of medical officers of health. So these boards, although they had very minimal authority, but they were the first ones established to look at health. They were the first ones where the British state decided that health is important. Health of the people is important for them. Then gradually this led to more and more health laws, more and more expansion of health. So there was compulsory immunization for smallpox in 1853. And as the effect of slums became more and more clear to people, there was this Sanitation Act of 1866, which gave local government powers to establish sanitation, sewerage. Then, of course, there was the Housing Working Classes Act of 1890, which gave the local authorities power to establish minimum standards of housing. So they can check the houses whether they are good or not, and they can also abolish the houses which are not fit for living. So this helped to decrease, although not eliminate, but decrease the slums around the cities. Local doctors were required to notify the authorities about epidemics in 1889. And in the 20th century, as there were improvements in medical knowledge, more statistics, more data, and more new technologies, this gave impetus to public health. So immunization for other diseases was also made necessary. Hospitals were separated from poor law infirmaries. So hospitals were not linked with poor law. So other people, middle class and upper class people, can also go there, and of course it helped to improve the hospitals too. And then local governments were made responsible for these hospitals in 1929. Thank you.